What is the hidden danger in our mouth? You see, there are specific bacteria that can cause issues in our mouth. They can cause inflammation, and they produce some toxins. We call them lipopolysaccharides or LPS. So these can trigger inflammation, lead to gum disease, and even contribute to serious systemic problems like heart disease. So let's begin with the basics. See, the gums and the surrounding tissue can become inflamed and infected when these harmful bacteria accumulate, especially from plaque and tartar. We call them gingivitis. If left unchecked, it can progress to periodontitis. It's like a deeper chronic inflammatory disease that damages the gum and the bone around the teeth. Many of these bacteria are involved here, produce that toxin, we call it, on their cell walls, they have something called, they release something called from their cell walls called lipopolysaccharides. It's a toxin. Because of this bacterial overgrowth or tissue injury that happens, this can act as an inflammatory trigger. This means poor oral hygiene is not just about the teeth. It can set off inflammatory cascades. Here's what research has uncovered about danger behind this infection. Once this oral bacteria or bacterial byproducts that we call LPS overwhelm the gum barriers, for example through micro tears that happens in gums during the chewing or brushing, they can enter the bloodstream. And once in the circulation, these bacteria or their toxin byproduct can trigger immune system activation and inflammation, including the lining of the blood vessels inside, and create something we call oxidative damage or stress. And that's upregulates the inflammatory cascades in the body, which is systemic now. So over time, this chronic low-grade inflammation may contribute to development of plaque formation even in the arteries. We call it atherosclerosis, vascular damage, and increasing the chance for cardiovascular issues. See, oral pathogens or bacteria in the periodontitis issue have been identified within plaques. Inside the plaques, they kind of hide in there. And even same thing inside the arteries. And it's a direct link between the oral infection and vascular disease, heart disease. So the mouth, in a sense, can be a gated way, influencing systemic inflammation and cardiovascular issues. Let me share some research with you. There was a 2023 large meta-analysis study that found that patients with periodontal disease have a significantly higher risk of coronary heart disease and stroke, supporting the idea that the gum disease is associated with cardiovascular disease. Another study in 2023 showed that periodontitis and low-grade periodontal inflammation is associated with higher all-cause and cardiovascular mortality. See, reviews summarizing decades of research conclude that periodontal disease, being a chronic inflammatory and infectious conditions, may act as a modifiable risk factor for cardiovascular risk and disease. So these bacteria and their byproduct triggers the immune system, as we said, and that may accelerate this vascular damage and promote that plaque inside the arteries. Given with what we know about chronic inflammation, immune dysregulation, and metabolic stress, this pathway is very relevant for people with metabolic syndrome and autoimmune disease and neuroinflammatory conditions like multiple sclerosis. In short, poor oral hygiene and gum disease are not just a local problem, they contribute significantly to systemic health issues. So here's why I believe oral hygiene must be part of any comprehensive metabolic or autoimmune wellness. Chronic systemic inflammation is a known driver for insulin resistance and lipid or high cholesterol, bad cholesterol, all hallmarks of metabolic syndrome. Having oral inflammation, constantly feeling systemic immune activation undermines the metabolic resiliency. And as far as autoimmune clients and MS patients, oral derived inflammation may tax the immune system further, so exacerbate the immune dysregulation and the oxidative damage, and contributes to flare-ups. For people with neurological health, the vascular inflammation, even inside the brain, and passing this bacterial toxins to the brain from blood-brain barrier can contribute to neurodegenerative disease or cognitive decline. So addressing oral health is basically low cost compared to the health issues that can create, and it is underutilized. But it's a powerful intervention, far simpler than many high-tech therapies. This aligns beautifully with whole body root cause approach. Treat the body as an integrated system: mouth, gut, metabolic system, immune system, brain, not as an isolated compartments. So there are some actionable steps that you can take, especially with people with metabolic syndrome and autoimmune disease. First of all, oral hygiene. Practice this diligently. Brush your teeth twice a day, floss at least once a day, or do a water pick to clean between the teeth. And once in a while, it's okay to use antiseptics, but do not use it too often, because that can destroy the good bacteria in the mouth. Have a regular checkups with your as a dental checkups with your doctor, healthcare practitioner, and so that you're preventing the buildup of plaques and tartar, because this is where these bacteria can accumulate and causing damage. Support your detox pathway, your immune system with anti-inflammatory diet, good sleep, movement, exercise, and because these things amplifies the systemic inflammation. And for autoimmune and metabolic clients, treat oral health as part of your metabolic foundational support, along with digestive care, nutrition, stress regulation, sleep, movement, and all that. And if you notice gum bleeding, persistent bad breath, or loose teeth, or gum recession, do not ignore it. Address it as soon as you can. Go to your dentist. So your mouth may be quietly influencing your entire body. Poor oral hygiene, especially when these bacteria are present, doesn't just threaten your teeth and gums. It can feed systemic inflammation and impair the metabolic balance and worsen the autoimmune and neuroimmune conditions. If you're someone dealing with metabolic and autoimmune disease, chronic fatigue or inflammation, this is again a foundational area that deserves your attention. If you need help, you can click the links below, and you can have a free discovery call with me.